58 years after Nigeria's independence, it has seen 5 national development plans, and yet the health sector has not been marked by any spectacular achievement. Nigeria has a life expectancy of 53.8, with main health issues affecting youths aged 15 to 24 being HIV and AIDS. In 2017, CIA reports 3.1 million people living with HIV/AIDS, 150,000 deaths, with the deaths rising in adolescents and 25% of them unaware that they have the disease. Complications linked to pregnancy and childbirth are the second cause of death for 15 to 19-year-old girls. The major challenges of the health sector in Nigeria, constant over the years, are mismanagement at the government-run hospitals, unhygienic conditions, severe shortages of machines and medical supplies in the hospitals, water supply and sanitation, HIV and AIDS, malaria, endemic diseases, maternal and child mortality, and road traffic accidents. To add to this, there are only 72,000 doctors catering for about 198 million people, with a density of physicians per 10,000 populations at 4.
When you go to different health centers, you don't have doctors, sometimes you have doctor. Those are the problem. They should employ more health workers in order to solve this problem. The infrastructure. You don't go to hospital, you don't have syringe, there are no gloves. How can you work?
The current brain drain of Nigerian trained medical doctors has 50% currently practicing abroad, and this is attributed to the poor working and service condition.
I'm a Nigerian medical doctor. I've been practicing for the last 5 years. I practiced for 4 years in Nigeria and practiced the last 1 year here in United Kingdom. Medical practice in Nigeria was tough. It was good. It was nice because we had to read. I mean, we had to do lots of work, but that's the thing. I did a lot of work, but I didn't get the fulfillment that I was looking for. And I'm talking about financially, but not just that. I had patients come to me whom I genuinely wanted to help, whom I genuinely had the knowledge to help, but I had no resource to help them. And I watched people die of silly things, I would say. I worked as a registrar for a year and 8 months in a very big teaching hospital in Nigeria. And I remember a particular night where a woman died because there was no glucometer that we could use to check her blood sugar. And by the time the results came from the lab, 8 hours after we sent the bloods to the lab, she was already 4 hours dead.
Remaining 50% currently practicing in Nigeria have the same complaint. The healthcare system is at its worst.
Working as a young medical professional in Nigeria has been quite challenging. The first challenge I experienced was that it was really difficult for me to get a place for my housemanship or internship. It took quite a while. This wasn't what many of us expected it to be. It took some of us from between a year and 2 to get a place for housemanship. Working in a hospital environment, I also discovered a lot of things. Doctors were not being employed enough. This greatly increased the workload of the available doctors. They had to work longer hours and it was really more stressful. Our hospitals are also not equipped enough. Hospitals are ill-equipped. This has really reduced the quality of care that patients get.
The ranking of hospitals worldwide put the first Nigerian hospital at 2,091, which is the neuropsychiatric hospital, Aro Abeokuta.
The WHO, World Health Organization, brought out a ranking of World Health System in 2019. Nigeria is number 187 out of 190. We are just above Central African Republic, the Republic of Congo, and Myanmar. Every other African country is ahead of us.
This shows the level of healthcare quality in comparison to the rest of the world and how serious attention and steps need to be taken to improve quality of healthcare.
The truth is, for Nigeria to be able to deliver health services to its 198 million Nigerians, it must focus on its primary healthcare centers.
It is critical that the Nigerian health sector innovates and collaborates with other sectors such as technology and business to foster solutions for health sector problems and elevate the practice of healthcare in Nigeria. Susan Jasper, reporting for Plus TV Africa.